My name is Thembi Arries. I am a medical intuitive. I use alternative techniques to diagnose and treat illnesses. I've done this for over the years, and I've successfully diagnosed and treated people with the most complicated of illnesses, which have baffled even the best of some of the medical specialists.
Join us on their journey to better health and renewed hope. This is Dr. Alternative.
Welcome to Dr. Alternative. Welcome to our show. We are back again with a different content today. We're looking at COVID, its effects, and the reason why we have brought it back again is because of the current state of affairs globally, particularly in America actually, where Dr. Anthony Fauci, who was the face of COVID and vaccination and masking and everything that was going on, is facing an indictment in America because of all the stuff that has erupted since then. So our show today is going to be looking at that and those people that are maybe suffering. We're going to be exploring how we help you and make sure you don't go away.
Hi viewers, welcome back on our new topic today. As Thembi has said, we are discussing over COVID. So my questions is based on the COVID vaccine today. Stay tuned.
Just to refresh our memories, which are not pleasant actually, but just to take us back where we're coming from, let's just have a look at this clip.
The year 2020, with an outbreak of coronavirus, is still causing bleeding hearts till today. People lost control of their lives in an instant. The worst that cut deeper was isolation, which deprived people a chance to even bury their loved ones. As if that was not enough, then the vaccine was introduced. The propaganda to promote it was so well organized that anyone who refused it was ostracized not only by their employers, but by their own friends and family members. This was the most devastating period in our health history, in our economy, in all the institutions that serve our societies. 6 years after, Dr. Anthony Fauci, the American physician and immunologist who was the brains and the face of the manner of operations at the steering wheel, is now facing indictment. All this was a well-planned game of Dr. Fauci and his cronies, all for their gain and ego gratification.
Welcome back. I know that maybe this is opening some old wounds because there are people who suffered. In fact, all of us suffered immensely at that time. And some have not recovered, some died, some are still struggling with the effects of lost businesses, of lost jobs. Even within the medical field itself, there are people who were fired because they refused to take the vaccine and they refused to be part of the vaccination program. They refused to give vaccine to people and they refused to take it themselves. So it's a really very nasty experience that we are staring up today. But that is the reality of life because, as I've said earlier, that lid has been blown open again, and Fauci is facing some serious questioning and even a possible jail sentence, as people are saying. Some are even saying jail is actually going to be kind for him if you compare that with what he has made people go through while he knew That was the whole idea of controlling people in the first place. But just to narrow this topic, because it's a big one, we have narrowed it to what it means to you, and Lorica is going to be assisting us with questions in that regard.
Okay, thank you, Thembi. I understand that you have identified a number of people with COVID vaccine. What are the common symptoms that they display?
Actually, I remember that during that period, I had a lot of people that called me wanting to know, should they take the vaccine, should they not? And almost every single one who called me, I told them, don't go near that vaccine. And if people can still remember, because we still traveled, at least we were allowed to still see people, because we fell under the essential services, that is health. So I could still consult, I could still see people, and people used to when they come to me, they would like, you're not wearing a mask. And I would say, not only am I not wearing a mask, take off that mask off your face, And people seriously were kind of scared, but now scared in that if a police were to come to our offices and see that we're not wearing masks, they feared that. I mean, that's the amount of fear that was instilled in people's, lives and their minds. So, firstly, that COVID, it never flustered us at St. Mary's or me, not by a long shot. Okay. Secondly, so that is why you find I never worried about the mask, even in church. Remember in church, because everybody, I mean, I'm a Catholic, and one thing that shocked me about the decision that our church took, because I thought they would stand against the government and say, we're not going to stop celebrating Mass. I was like, are you kidding me? That the bishops, they're allowed a conference, they're allowed. I'm still convinced till today that they could have stood against, resisted the government. But, well, they didn't. But fortunately, for me, I happened to be in Coxted, and one of the priests in Coxted was just celebrating Mass every Sunday. So, and I was so blessed to be there, because I never missed Sunday Mass, while everybody could not go to Mass. That's God's providence. I really thanked him for that. So, but now coming back to the implications, the implications. So in church, we were not, when I came back to PE, not allowed to, that was now at the time when they opened doors, so you could still go to church, but then wear the mask. So I wasn't wearing mask, and I remember one colored lady, that we used to go, that we belonged to Marriage Encounter with, which is a church ministry on building solid marriages. So I used to belong to it with my husband when he was still alive. So now we ended up knowing each other as these couples. Now this lady, she sees me, she visits our parish, and we get along. It's not like we're visiting each other, but even if we see each other in the mall, I tell you, now she sees me in the parish. She's visiting, and they're all in masks. And me, I'm sitting in their rows, but with no mask. And then she says, Thembi, put on your mask. I mean, she's visiting in our parish. I know her, but she doesn't. Put on your mask. And I'm like, are you kidding me? So that is how much effect it had on people, that she did not just, she has covered herself with a mask. So why does she worry me? Why is she worried about me? Me, if I get COVID, I catch it. But she is covered, so she's protected. But that's how bad it was in causing conflict among people. You know, people who are families, people who are friends, and even people who refuse to take the vax. You know, you'd find that people within a family, they would tear each other apart. You know, you belong there if you haven't taken, and COVID is going to kill you, and wara and what. So what I'm getting at is that the adverse effects that came from that thing were so far and wide. It's really very scary. But now coming back to your question as to what are those symptoms? The one that is quite consistent, that I've found, particularly in the people from Gauteng, you know, I don't know, it's polycythemia, you know. I would ask a person, have you taken the vax? Why do I see, and then the person says, how do you know? Because I know that people that have taken the vaccine, it's very common to find them having polycythemia. Now, polycythemia is when you're making more red blood cells than you should, the red blood cells that are used to make blood. So you're sitting with more volumes of blood than you should, which is very heavy for the heart, very heavy for the cardiovascular system, because that heart must pump that volume of blood. And if the quantities or the volumes are more than the natural volume that it's supposed to carry, so that really puts it in a pretty bad state, you know. So which is why you find a person might have a heart attack, might have stroke, because that blood that is circulating, which is more, you find it may congeal, it may accumulate in a particular area, depending on where it's sitting. So there is that. And where it tends to sit and it accumulates, you find people will also develop a subsequent problem of dysfunctional endothelium. Okay. Now the endothelium is the membrane that is covering the inside of the blood vessel. So when you're sitting, now remember it must contract. It's like a little heart within the blood vessel, which must pump the blood forward. The heart pumps into the blood vessels pump forward. But now, once you're sitting with blood that is thickening and that is damped in that particular area, then you find the membrane is distended. So the contraction becomes a problem. And when that happens, you're going to feel a lot of pain. So that's one big one that I have found to be very difficult for conventional to detect. Because when it's endothelium, I mean, if you've got I remember even my brother took a vax. Of course, we were not together. I was in Coxted at the time, and he was in PE. And I don't know if we were together, if he would have listened to me anyway, because people would just not listen. So he took the vax, and I said, but no, he was convinced that, I mean, together with his friend, I remember one time we were sitting and we were chatting, and they were saying, in fact, the friend was saying, hey, Yabona wena Thembi, hey, you are going to drop dead with all this stubbornness of yours because you didn't take the vax. And I said, no, it's actually going to be the opposite. You guys are the ones that are going to drop dead because the vax is going to nail you. So we're just joking about that. So 2 years down the line, my brother started experiencing serious pain. Serious pain. I had responded to nothing. So, and when I scanned, I saw, oh, your endothelium is so seriously distended, it's not functional. That's what saved him. I said, you see now, if it were not because I'm your sister, where would you be with your vax? So that's what's happening. So the common one is the polycythemia. But let alone the polycythemia, most people that have taken the vax, I think we did a show some time back where we were showing that sports people would just drop dead while playing or running, or young people, old people were just dying instantly. Heart attack, mostly heart attack, because of what it clogs, because of this polycythemia that I'm talking about, which you'll find they may not have been aware. Because when you've got polycythemia, it's not like you're aware that you've got it. I discover it because I'm scanning you, but otherwise maybe you've got a leg pain or shortness of breath or whatever. But nothing takes you to the fact that you're sitting with huge volumes of blood until it knocks you. So it's actually a silent killer. So that's one big symptom that I have consistently found among people that are vaccinated. Whether they tell me or not, I do pick up. But it doesn't mean that polycythemia is only limited to people that have got COVID, that have taken COVID vaccine. People that have got kidney problems, you find they may also sit with polycythemia because the hormone that is produced in your kidneys that is used in the bone marrow to give the message that we need blood is actually coming from the kidneys. So when there are issues with the kidneys and then they end up disturbing that particular hormone, then you find the message is incorrectly transmitted or whatever, and then you might sit with polycythemia. So I do pick up polycythemia in people that have got kidney problems who have not necessarily taken a COVID vaccine. But that's the common one. So if you are sitting with, whether you tend to have sharp pain or whether it's shortness of breath that you may think it's still linked to the fact that maybe you contracted the COVID, or you're having a headache, dropping headaches, or whatever, if you're sitting with something that is persistent, that is not explained or that is not corrected by the medication that your doctor has supplied you, you may very well be sitting with polycythemia if you took the COVID vaccine. But we'll be able to tell you if I scan you. Okay.
All right. Let's go with the next question. There are people who I heard you calling long haulers. What kind are those?
The long haulers, I was just talking to another one just in my previous visit. The long haulers are people who just don't recover from the symptoms of COVID. You find that they did contract the COVID and they were treated, but then it takes a long time for them to recover. Some are still suffering till today. You find it may either be the shortness of breath, or they feeling the body pains, or they are tired, but they just don't get well to where they were before they contracted the virus. And some of them, you find they never took the vax. Why? Because at least with the COVID vaccine, you had to be well. So when you are sick, you were not allowed to take the vax. So and those, therefore, you find that they missed, therefore, that chance of being forced to take the vax, which in a way worked in their favor, because now they would be dealing with two things: the virus itself and the vaccine. But then people that are long haulers, you find that they are people that may have been sitting with other conditions, but they were not aware. Like, for instance, these people that you find, some of the people where I find they've got cardiac problems. Like this one that I'm talking about, He is a COVID survivor, and he's kind of placed in the long haul. He's still sitting with respiratory problems, but he's got cardiac problems. But his cardiac problem is also linked to the fact that he had mucolipidosis. Mucolipidosis is a condition where you have got a defective gene that makes you not metabolize fat properly, and then you end up sitting with fat structures that clog certain parts of your body systems, including the arteries, you know. So now, when you're sitting with those kind of things that you were not aware you've got, because if you've got mucolipidosis, how many people actually know what it is in the first place, you know, let alone it being diagnosed by their doctors. So you're sitting with that, and it's causing its own problems quietly, and then voila, you know, you get the virus, and then it hits you really hard. And this is one other thing. I was telling another person, a different person, who is someone that I treated some years back because of the heart that was really packing up. I mean, I think she had a fistula, you know. A fistula actually is when the arteries and the veins, the contents of your arteries and your veins are converging at a wrong space. They must converge at the capillary juncture, where naturally all the necessary ingredients and particles are there to receive from the fast artery and then to transfer to the slow vein. But if they meet somewhere in a different space other than the capillary juncture, then you find there's contamination of the blood, which affect the heart, depending on especially, you know, where it is. So she had that serious condition, serious condition. But now I treated her and you know, and fixed and sorted, closed the fistula and whatever. But now, just recently, about last week, a week ago, when I say, but now I see that it's the calcium. The calcium, she's got calcification, but now the calcium is actually clogging the pulmonary vein, and that is affecting the pulmonary vein and is affecting the heart. But now she's not experiencing any sharp pain or anything that's got to do with what you would, you know, no shortness of breath, no sharp pain, no fatigue, no tiredness, no nothing. And she says, no, I'm not experiencing anything. So and then I say, but this is what I'm picking up. And then she said, no, I'm fine, except for the only time where I experienced something was the coughing, which I experienced some months back. And she said it was the coughing. In fact, she did not say it was the cough. She said it was umkhuhlane. Umkhuhlane, that's a Xhosa or Zulu name to say you've got flu. Okay. And then I say, okay, what were the symptoms of that flu? And she said, was I coughing? She said, I was coughing and coughing. I said, that was the heart. I said, that was the heart. Remember, the heart does not only talk through sharp pain or shortness of. I said, coughing, that you find it. I said that was the heart. Especially that the calcium is actually obstructing. So when you're coughing, it's trying to push that calcium. It's pushing it, it's trying to open. So that's why you were coughing like that. I said, yeah. I said, and I even said, and then the other thing that she said, she's experiencing, she said her bowel movement is very sluggish. She does not feel the urge to go to the toilet, because it's one thing to feel the urge, but when you go and relieve yourself, you find you are constipated, you're struggling. But it's another where you don't feel the urge at all. You can even forget that you did not go to the loo. Meanwhile, you're eating. So she said, that's the one that she experienced. I said, that is also the heart. So I'm saying, that is also the heart, you know? But I'll explain when we come back from the break. Let's go for a break, and when we come back, we're going to discuss this further.
If you are fructose intolerant, you should not eat fruit. Otherwise, it will harm your health extensively. This is a genetic disorder directly connected to adenylase enzyme deficiency. Diseases including tissue cancer.
My name is Rachel. I am 35. Well, I was diagnosed with GIST, which is gastrointestinal stromal tumours. It's really rare. It's a form of sarcoma. It starts in like the connective tissues, and for me that was the lining of my stomach.
Liver disorders and mental disorders. How do you know if you are fructose intolerant? And even better, what food you must eat?
Welcome back. We are talking about COVID, the adverse effects of COVID in our health, and also the adverse effects of the vax in our health. But our discussion is not just or limited to just COVID, but I'm covering other related conditions just to give more clarity to you about how the body systems work and talk to each other. So now, with the sluggish bowel movement, and then I tell her that firstly, you must know that the stomach and the heart, they've got a common regulator, which is the medulla oblongata, at the back part of your brain. There are people who will have a heart attack, but will not experience chest problems, but will experience sharp stomach, and some will even die from the stomach. They say, no, the person had a stomach ache, which responded to nothing, and they died from that. That was the heart attack, you know. So that was that heart attack, when they do the autopsy, that's when you find they realize, oh, this person actually experienced heart attack. So the stomach and the heart, they belong to one regulator, the medulla oblongata. So then I'm telling her, I said, do you realize that when the heart is pumping, it relaxes and it contracts, relaxes and it contracts. When the bowel, when you must go to the loo, same peristalsis, the colon must squeeze and release, and squeeze, the same movement, the same peristalsis. So that's, so I was saying, because that heart of yours is taking a lot of strain from that obstruction. So it was trying so hard to come. Now, where is it? It's affecting your bowel movement now because it's sluggish. So your heart is, the contraction is compromised because this is what happens even in other people. And I said, one organ, in fact, there are 3 organs that die quietly without giving serious symptoms. The heart is one of those, the liver is one of those, and the kidney. Those 3 organs, they will die. I see people, a person saying, I say, oh, your kidney. And they're not even suspecting that there's something wrong with the kidney. So the liver and the heart and the kidney, those organs, they die quietly without giving serious, it doesn't mean with everybody. So that's what I was telling you. I said, your heart When I treat, I'm going to clear that calcium that's actually obstructing. But that coughing that you experience then, which hit you like with ton of bricks, as you said it lasted about 10 days. I said that heart was trying to get rid of this calcium, but it's still sitting with it. So now what's happening? It's tired because that calcium is sitting there. So now you're wondering with your bowel movement, the sluggish, it's tired. So that peristalsis, so it's like, okay, we'll see when it happens. So that's what is happening therefore. So coming back to your comment or a question about long haulers, people who are long haulers are sitting with, when the COVID hit them, you find that they were sitting with underlying I remember that they used to say it's comorbidities. And when they're referring to comorbidities, you find they would be referring to people that are diabetic and people that have got high blood pressure and maybe cholesterol. And so they were referring to that. They were not referring to deep, like mucolipidosis, people like who are sitting with that, people with calcification, you know. So I'm actually diving deeper into cases where you find people who are actually sitting with serious underlying causes that may have been missed, which is what made them to end up not recovering at all, because their respiratory system got weakened by the virus, but they were in any case sitting with underlying, and a combination of that makes them never to recover, you know, from that.
Okay. Can you give us example of typical long haulers that you have treated?
Yeah, I've got. I've actually got quite a few, but I'm trying to, let me see which one I can, because I didn't think. Okay, this particular one, now remember, people that have contracted or that contracted COVID, they would display respiratory problems. Okay. And the majority of them were they would have temperature, you know, high temperature. That's why you find that when they go to malls, they would use the thermometer. Yeah. So they would use that to test your, if it's above 36, then you are not allowed. But they never used to worry about people where the temperature is low. They are scanning thermometers. We're only focusing on high. And yet, people with low temperatures were sitting with COVID, you find that they've also contracted COVID, but it's hitting them differently from what they were watching. Now, this is this one person that I'm going to give an example was actually suffering from that. She was cold. She was just freezing. It didn't matter how well she would have to dress. She said even at her work, because she works in an open, almost like call center, but it's not a call center, but she said she works in an open space like that. So, but they ended up removing her and putting her in a side office so that she could at least be able to use her heater. And she said even with the heater, she would still feel cold. So she would still feel cold with the, she never used to understand, feel cold with hot. She said, I've got an electric blanket and I use even the hot water bottle sometimes, but I would struggle to even fall asleep. So that was her main condition. And But now, with that, now remember, what generates heat is the liver. But now, what that liver generates heat, but while it is generating heat, it is the heart that is pumping the blood, because the blood must flow for you to be able to feel the heat. So that's why when they talk about cardio, then you find if you do cardio and then you end up starting to sweat and all that. But the generator is actually the liver. Okay. So now with her, as she comes to me and she's like, yo, I've run out of options. Even the doctors, they don't know how else to help me. And here, what do I discover? Fructose intolerance. I mean, people still cannot believe how dangerous fructose intolerance is and how it affects people's health. She was fructose intolerant. So that liver, now remember the liver, as I'm saying, it generates heat, but the liver also is involved in the blood formation. In what way? It is the one that makes albumin, which maintains fluid within the blood. It makes a clotting factor, which determines the texture of the blood. So it is very much involved in a number of other things, that have got to do with blood work. So now here is her liver, which is buggered by fructose intolerance, aldolase B deficiency. And she says, I am taking vitamin C not only in supplements. She said she didn't take the shot because they would not allow her because you must be healthy to get she said otherwise she wanted to take the vitamin C shot. But she says, I'm forever juicing oranges and lemon, everything, because they said I must actually increase in the intake of these oranges and lemon, and I'm taking supplements, but not the shot. She didn't take the vitamin C shot. So she says, I am forever sitting, even if you have to go to my office, even though I don't take it cold, I will warm it up a bit. But because they said I must get as much vitamin C, but I'm not improving. And I say, because you're taking something that you should actually be avoiding. So that liver is saying, oh my goodness, So she was destroying the liver because she believed that if she takes vitamin C, excess vitamin C, that's going to beef up her immune system and help her not to get so cold. But in the meantime, she's fructose intolerant, so that fructose intolerance is finishing that liver. So that liver is not in a position to generate the heat. Okay, so that was her main problem. But she didn't have serious respiratory issues. It was just temperature that was just there. So she was categorized in the long haulers because she fitted in that category, But meanwhile, of course, she was a long hauler in that she had this underlying condition of being fructose intolerant, and that was affecting her liver. Aldolase B was affecting her liver, and therefore that's why she reacted in that way, differently from the most of the people, because the organ that was hardest hit was that liver, which is the heat generator. Hence, her temperature was dropping instead of rising. So it's a unique example that you would be able to give answers to, because the question was, why is she different? Why is she different? Why is she because she was not having all these shortness of breath and all that. But that's how the body is, which is what I'm always stressing, that the body is better than AI, I'm telling you, the body is better than AI. The AI is actually mimicking the body. but it can never get to that level. So, because that's the real thing, God's creation.
Okay. Yeah, over to our next question. What kind of assistance do you offer to COVID stroke vaccine sufferers?
Well, firstly is the scan. The scan tells me what's going on. And there is nothing that will beat knowing what's going on in the body, okay, in your body, how the COVID has affected. Now, okay, let's say you contracted it, you went through the motions with it, but now you don't know where you stand, because most people that were my old clients who asked me what must they do when it comes to vaccine. I said no, but they said I'm going to lose my job. You know, I'm going to lose my job, and so I've got to take it, and then I can just come to you, and then you can tell me the state that I'm at, and then we can take it from there. So most people that could not avoid being mandated to take the vax ended up following that direction, coming to me in that direction. So okay, what I'm getting at is the scan tells me where are you at, okay, because that's what marks the point of departure, okay. And then once I've seen where you are at, even this thing that I'm talking about, that people that have got polycythemia, people that you find have got endothelial dysfunction, they're sitting with congealed blood in a particular area, whether it's the chest or it's the what, or the arteries are distended, because that's the other thing that I've found, that there are people who you find the arteries will become anurated, they become distended. And that also is a problem, because when your arteries are stretched out, remember they must be elasticity, they must be elastic to contract and relax. So that's now beyond the endothelial dysfunction. That's when you're really losing the elasticity, not in the inside now, but on the outside as well. So then you find it bulges out, or it's like it's being pulled, it gets constricted. That's the other thing that you find will cause the heart attacks or the stroke, because when it's constricted. But when it's bulging out, it will just cause maybe issues of contraction and relaxation. So you might find there's congealment, you might find there's shortness of breath, you might have a shortness, you might feel tired, you might feel sleepy if you're not doing anything, because it even sometimes leads to cardiomegaly, enlarged heart, because that heart works even harder. So those kind of cases are also in the list of people where you find I will be able to detect, and then I will help accordingly, you know. So the scan guides me. I will, you know, it will show me. And then the kind of assistance I've said, that the scan is a point of departure. Then it will tell me, okay, in your case, it's causing your arteries to be distended. One person even asked me, because she got such a fright, when I said, your arteries, and it's someone who used to be a nurse, I said, your arteries are distended. Now the risk of having distended arteries, that's what we call aneurysm, when it's stretched out. The risk is leakage. You might find that distended artery may end up having a tear that causes it to leak. Then you find you lose blood, you bleed internally. That's dangerous. The other one is the rupture, when it bursts. Now that one, when it bursts, no one can can save you, unless where it's bursting, it's not too big, and you're very close to the hospital where they can pick up that you've got this, then they can close that part that is best. So, but aneurysm that bursts is the riskiest of being fatal. But when it's leaking, it's also difficult for conventional to pick up the leak. Because remember, in all these metrics of the blood vessels, and there's a leak, how are you going to see where's the hole? You know? No, seriously, how are you going to see? So I can understand why it's so difficult for them to detect certain things. Because maybe it's not a big hole. It doesn't have to be a big hole for it to leak. If there's a hole, it's going to leak. And I remember I had one gentleman, was a white gentleman who he didn't know anything about leaking. He had epigastric pain. This thing that I was talking about earlier, that people may have heart problems and they may manifest as gastric problem. He had epigastric pain. He was in such pain. And he said, when it comes like it's going to kill me right now. And he said he's been to every gastroenterologist that you can think about. And I say, because when I scanned him, I said, oh, you've got a small hole in the septal. You've got a small hole. And I said, have you ever? He said, not one person ever sent me to a cardiologist. Because if they had done that, maybe they would be able to pick it up, you know, in the CT scan or whatever machine they are using. He said, no one. But I say, yes, actually, although he could not see it. But that epigastric pain was actually because of the hole in the septal, the middle part of the heart that separates the chambers. Septal, so he had a hole in that septal region there. That was what was causing him to have that kind of epigastric pain. Then he asked, what could have caused? And he had hemochromatosis. Now, hemochromatosis, that's too much iron. If your liver is storing too much iron, then you find that iron, wherever it's dumped, it's very corrosive. So he had hemochromatosis, and he said, that one I know. He knew that he had hemochromatosis because he said every month he would go to the blood clinic, and they would draw blood, do phlebotomy, to throw away, not to give to anyone. They would do phlebotomy and draw blood so that they could throw. He said, that one I know. And I said, that is what has caused your heart to have this tear, you know, and that's what's causing your epigastric pain. So what I'm getting at therefore is that I will be able to see how COVID, a virus, has hit you, and then we take it from there. We see where the damage is, and then I'll be able to map out the way forward. So what I'm getting at therefore is that for those people that are long haulers, or even who took the vaccine, but who are not even sure where to place themselves at this moment, I'll be able to assist you in that regard. Thank you for watching, and goodbye.
Okay, thank you viewers for tuning in. This brings us to another episode. So till next time, stay tuned.